Imagine being able to be pain-free without numbness tingling to your arms or to your legs. I help and enable people like you with families like yours to be able to live longer in this planet. At this time, I want to ask you permission to help you. The choice is yours. Imagine being able to sleep well, having the energy to go throughout the day, being able to enjoy life to the fullest with your family and friends, being able to play with your children, not being labeled that you're having this or that condition, and having to take pills for the rest of your life. Imagine not having to deal with being chronically fatigued, having low energy, mood swings, having night sweats, balance problems, having sleeping problems, not having to deal with hormonal imbalance, metabolic problems, menopausal symptoms, hot flashes, being depressed, having constant acne and skin problems, having breathing problems, battling with weight gain. If you're suffering from any of these symptoms, you may be having an autoimmune condition. Autoimmune condition is a condition where your immune system wants to fix something in your body and it cannot. And as a result, your immune system attacks a body part or an organ. And then you experience the symptoms that you're having. And the problems start with the organ. So you need to find the true cause and not to mask the symptoms. If you have a sleeping problem, the solution is not Tylenol PM. The solution is not time release this, time release that. The solution is not Ambien. We need to find the true cause. If you feel always that you're fatigued and have low energy, the solution is not an energy drink. The solution definitely is not Red Bull. We need to find and fix the cause. Most patients, they go to doctors. Your doctor looks at your symptoms and runs some tests. And as a result of the test, you're labeled as having, for example, rheumatoid arthritis, where your immune system is attacking your joints. Sjogren's disease, where your immune system is attacking the moisture-producing glands. Lupus, where your immune system is attacking your kidneys and organs. Scleroderma. Hashimoto's, where your immune system is attacking your thyroid. Graves' disease. MS, where your immune system is attacking your brain and spinal cord. Celiac disease, where your immune system is attacking your intestinal tract. Addison disease, where your immune system is attacking your adrenal glands. Myasthenia gravis. Type 1 diabetes, where your immune system is attacking your pancreas. My name is Dr. Maz. I practice at MedWell L.L.C. in Midland Park. We are a panel of doctors and therapists working together at one location. I'm also the author of this book, How to Live Pain-Free and Happy. Drug-free, non-invasive, non-chemical, non-surgical steps for resolving chronic conditions. If you experience any of the symptoms that I mentioned, you may be having an autoimmune condition. you should listen carefully to what I'm about to say. If you're diagnosed with an autoimmune condition and are given a list of medications to take for the rest of your life, you should listen carefully to this. If you experience fatigue, low energy, mood swings, night sweats, sleeping difficulty, if you experience hormonal imbalance, menopause, hot flashes, being depressed all the time, having skin problems, if you gain weight easy, and you do not want to take medication the rest of your life, you should stop this video and take a pen and piece of paper to take notes, because we're going to go over a lot of information. You are about to hear some groundbreaking, transformational knowledge which has helped hundreds of chronic patient sufferers successfully nationwide. I have studied over 10 years of latest research in diagnosis and treatment of these series of conditions. I'm also trained by the country's leading expert, Dr. Michael Johnson, with functional endocrinology, functional neurology, and functional medicine. The problem is that in most cases that I have seen, you are misdiagnosed or not diagnosed properly. That means there is another reason that is causing your symptoms and making you feel the way you are feeling now. You do not want to cover up your symptoms. You want to find and fix the cause. You have these symptoms because you are a sick person. You have these symptoms because you have a sick body. Your sick body is making your symptoms. Your symptoms do not make your body sick. Your sick body is making your symptoms. This is an eye-opening class. We do life-changing care in 6 months. I just want to tell you that I don't want to be abrasive. I don't want to be rude. Don't get me wrong. Most people like to be nice than effective. I want to change your life, and I want to be effective. I'm very serious about fixing your body. My goal is to add value to your life so you're able to do what you want to do and spend quality time with your family and friends.
I'm having therapy done here at MedWell. When I first arrived, I was having lots of pain, taking a lot of medications, and more than I wanted to, and was uncomfortable on a daily basis. Since being here, the relief has improved, the medication has diminished, and I feel great now.
I want you to ask this question from yourself. Ask yourself this: if I continue doing what I have been doing, or I'm currently doing, if I continue taking the medications that I have been taking, will I be better, same, or worse the next year or so? Most likely, you will be either the same or worse. If your current treatment plan was supposed to fix your body, you would have been fixed by now. If your medication that you are taking now was supposed to fix you, you would have been fixed by now. By all means, I'm not telling you to stop your medication, change your medication, add to your medication, nothing like that. That is your responsibility with your doctor who gave you that medication. In no shape or form I'm telling you to change your medication or do anything with your medication. The reason no one has fixed you is because no one wants to fix your body. They want to fix your symptoms. I have seen patients who were on 7 medications. They completed this program and now they don't take any more medication.
I've only been coming to MedWell about 2 weeks, and I was literally crippled when I came in and couldn't sleep at night. And I have to say that at this time, I could sleep all night, through the night, without pain meds. I don't use the cane, I just can't believe the difference between my condition when I came in and today.
The purpose of this video is to inform you what is available to selected certified doctors and enable you to be able to enjoy life again. If your symptoms wax and wane, you better listen to this video. If all of your lab tests are normal and you still feel horrible, you better listen to about what I'm about to say. If you take a list of medications or supplements and you still feel horrible, there is reasons behind that. You are stimulating Th1 and Th2 part of your immune system. And when you do that, that could cause the problems that you're having. We will go over that thoroughly. The statistics shows that in the United States, there is 5% of the population of the whole world, but we as a nation consume 50% of the drugs that is consumed in the whole entire world. We as a nation like to cover symptoms. We need to not to leave any stones left unturned. We need to diagnose and treat you metabolically and neurologically. Why? Because your problem is metabolically and neurologically in most cases. What makes us different? We define what is the actual cause of the problem. We design a diagnostic plan to find that true cause and deliver the treatment on site. And by designing and delivering this therapeutic regimen, we are successful. Can we guarantee it? Absolutely not. Are we successful? Yes, we are very successful.
Hi, my name is Marjorie Durrett. I'm from Pennsylvania. I have an hour and a half ride each way. This is my third visit, and I had trouble sleeping. I was only sleeping like 2 hours and waking up every 2 hours. But after the first visit, I slept for 5 hours straight, and now I'm 3 hours, 5 hours, and I'm getting REM sleep, which I have dreams, which means I'm getting a better quality of sleep. Thank you, Dr. Maz, and I hope to continue and see more results.
There are certain lab tests that needs to be done to assess the true cause of your symptoms. Our job is to find that cause. Our job is to find out what is attacking your immune system. This is the part that is missed commonly among doctors. If you have an autoimmune condition, you will not get better, obviously. And that could be the reason that you're not better. If your immune system is being attacked and not get treated, you will not get better. You cannot take any drugs or medication to get better with the autoimmune condition. Autoimmune condition trumps all other chronic conditions. That has to be addressed first. If you're autoimmune, we take care of it nutritionally before your other symptoms are addressed. And in many cases, and many times, your other symptoms will disappear because your immune system does not have to work hard. So, here is how we are going to attack this problem. First and foremost is blood test. Before you get started, I just want to tell you that most likely most of you have had a lot of blood tests, or at least some blood tests, and you think to yourself, well, I did blood tests, that's out. Wrong. I guarantee you that you have not had all the tests that I will tell you that you need, and all of them have not been done. With the blood tests, normal does not mean you're okay. There is lab ranges and there is reference ranges. There is optimal ranges. Lab ranges, they're broad. Functional optimal ranges are narrow. Normals are made by the lab companies themselves, and it is designed for assessment of sickness, not health. We have sickness care here. We don't have health care here. We have to test 55 different areas of your body's function with the blood test. We have to do comprehensive thyroid panel, T3, T4, free T3, free T4, TBGs, very important, commonly missed, TPOs, very important, commonly missed, and TSH. Just by doing TSH, that doesn't mean your thyroid is normal. We have to do a comprehensive metabolic panel. We have to do a lipid panel and complete blood count with auto differentials. We have to do an immune panel to see if you're a Th1 dominant or Th2 dominant. This is important for people who take supplements and still feel horrible. Why? Because the supplements that you're taking, it's stimulating both Th1 and Th2. And that is why you're not getting better. And that's why you still feel horrible with the list of medications or supplements that you're still taking. There is two things that usually causing the dominance between Th1 and Th2. One is active antigen and the other one is dysregulation. Active antigen is parasite, bacteria, mold, fungus, yeast, protozoa, certain foods, heavy metals. Dysregulation is anemia. You may have anemia. Dysregulation is adrenal gland malfunction, gut function. That is why we need to do the testing. We have to test CD4-CD8 ratio. If it's above 2.5, you have active antigen. If it's below 1.2, you have dysregulation. Based on that, we have to find out if we're going to give you X-Vitamin or X-FLM. These are supplements, which we're going to go over later based on specific needs. We may have to do a natural killer cell activity challenge test. The next test, that's very important. You may have sensitivity to certain food. Now, I don't want you to think yourself that I eat everything, I feel normal, I'm good. Wrong. The only way to find out if you are food sensitive is to get tested. Symptoms of food sensitivity could be chronic pain, chronic fatigue, being fatigued all the time, frequent indigestion, bloating after eating, mouth ulcers. If you have sensitivity to gluten, eggs, milk, soy, or yeast, you will not get better no matter what anybody does. That is why it's important for some cases we do this test to see if you're allergic to gluten and how allergic to gluten you are. We have to do the test for gluten, casein, or celiac gene. These are toxins and we need to get rid of them in your entire life if you're very sensitive to them. Every time you put gluten in your body, you're destroying your body. Now, normal, when you do this test, normal is 0 to 10. We have had patients whose levels was 400. And did not know about it. This by itself would solve your problem. This by itself could solve your problem, could help you 70%. So that's why you need to get tested. I have not had any patient who stopped gluten and did not feel better. We will also look for tissue transglutaminase for celiac gene. You may have a celiac condition that you don't even know about.
I want to thank MedWell for everything. They have superior people here. They are just down-to-earth, helpful people, and I really had a great experience with MedWell.
The next important test is adrenal stress index. Adrenal glands, commonly not looked at. Adrenal glands, they're on top of your kidneys. They are your stress glands. If you're suffering from insomnia, sleeping problem, or possibly being heavy, being overweight, I assure you that your adrenals are shot. Especially even if you have been on diet and you haven't lost weight. I assure you, you have either adrenal exhaustion or adrenal fatigue. Adrenal glands, they're on top of your kidneys. Their job is to manage cortisol production. High cortisol is no good, low cortisol is no good. Good cortisol is good. Okay? So what happens, cortisol levels should be at its highest in the morning when you wake up, and at lowest at night when you sleep in the middle of the night. So what happens if your adrenal glands, they're working too hard, if you have adrenal exhaustion, this doesn't happen. In the middle of the night, cortisol level is high, morning is low. So what happens? In the morning you're fatigued after 10 hours of sleep, at night, in the middle of the night, you couldn't sleep. That could be your reason. That could be the reason that you haven't lost weight. No matter how much you exercise, no matter how little you eat, if your cortisol level is not balanced, you cannot lose weight properly. If your hormonal levels are not balanced, if the brain doesn't work properly to release certain hormones at the right time of the day, you will have a problem. If your brain functionally doesn't work properly, I'm not saying you have a missing part of your brain. Function, we're talking about function. Hormone production is a function. Which leads me to the next test. We have to do a hormone panel. Hormone panel is very important. We have to check your testosterone level. Important for low sex drive and low muscle mass. We have to check growth hormone. Growth hormone is known as fountain of youth. Progesterone, in charge of ovulation and menstruation for female patients. Female patients, if your progesterone level is not balanced, it could cause your sleeping difficulty, foggy thinking, brain fog, mood changes, weight gain. Most people tell you that they have their symptoms because of age, because of this. That's just a justification. Lack of energy, insomnia, so on and so forth, they are not real. They don't have to be there. I've seen many cases that these hormones reversed the effect of aging. It is called anti-aging medicine. And I'm involved in that. Many of my patients, they're on hormone creams. They take certain hormones based on the results of the tests. Now these hormones, as of age 30, if you take it, it facilitates, and if you need it, it facilitates you to stay young, feel young, and stay forever young. The symptoms of hormone insufficiency starts about the age of 40. And every year, your hormones, they're going to diminish. Now, hormonal imbalance could cause many problems and symptoms for us, as I mentioned, and can virtually give you a problem, and potentially we can reverse them with proper hormones. You may have an H. pylori. You have to do an H. pylori test. You may have a leaky gut syndrome. You have to get tested for these things as it's necessary based on your symptoms. We assess that. Leaky gut syndrome, H. pylori is very important. If you have bacteria, virus, parasite, any infection in your gut, we need to fix that. Because those things, they attack your nervous system, and that's why you're not getting better. You need to get tested on that. How do we know you have a leaky gut syndrome? Well, just to inform you, most people do. Why? American diet. Poison. McDonald's. Diet soda. Horrible. Aspartame. Toxin. It makes the color of your brain yellow. Aspartame causes osteoporosis. Diet soda is no good, no matter what the sweetener is. Why? Because of the carbonation. What comes out of your body you don't put in. You don't put gas in your body. Your body doesn't know what to do with it. In fact, what happens when you put carbonation in your body, that includes seltzer water, the carbonation. When you put it in your body, that carbonation needs calcium to get digested, to go out of your system. Where do you think the calcium comes from? Your bones. Aspartame toxin. This is not the class for this. That's a different DVD that we have. But aspartame, in higher temperatures, it becomes formaldehyde. Formaldehyde is what they preserve dead bodies in. So you keep these toxins in your body. And if your body doesn't know what to do with it, you gain weight. It keeps it within the fat, and you cannot lose the fat. I want you to understand something. Your gut does not have pain receptors. Your gut bloats up. You feel indigestion. You have inflammation. Your brain, same way. Your brain, you don't have pain. It gets inflamed. You get brain fog. You cannot think straight. You're stressed. People are so sick that they think there is such a thing as normal headache. People are so sick that they think that there is such a thing as normal lack of sleep and inability to sleep.
My feet were burning most of the day, and at night I'd have restless feet, so all night long my feet would drive me crazy. I came here out of desperation. I saw an ad in the paper. I didn't know anyone who would come here, and I just thought, well, I don't know what else to do. So I came here, and after a week and a half with the sort of therapy devoted to your feet, I have none of the symptoms. None. I mean none.
The next very important thing, most patients need neurological treatment and neurological evaluation. Yes, you heard me right. You need neurological treatment and neurological evaluation. Why? Because your brain, think about it, your brain controls your whole entire body. That means your brain controls your muscles in your back. It's cerebellum, the back part of the brain. Your brain handles all the functions, the release of hormones, progesterone, estrogen, testosterone. Your brain controls everything that happens in your body. If it works at its 100% functional level, you feel great. If your brain does not work properly, you'll have problems and symptoms. No matter how many medications you take for your thyroid, if your brain doesn't say the thyroid to release hormones, it will not. Your hormones will be off balance. If you have diabetes, there is a problem with the insulin production. If your brain doesn't say insulin to be produced, no matter how much medication you take for pancreas, you're not going to fix the problem, obviously, because you're still on that medication if you have diabetes. So you're not fixing the problem. You're masking your symptoms. You're tricking your body. How long you have to take the medication? Rest of your life. Neurologically, we need to examine and test you. I'm not talking about your brain has a problem, you are mentally sluggish in a form of you're missing part of your brain. No, we're talking about function. Neurologically, we need to examine and test to see how well your brain works physiologically. There are tests like you stand up with eyes open, we check your balance, eyes closed, we check your balance. We have you walk a little bit, we do certain maneuvers as I mentioned. We look for your eye movements, so on and so forth. We look for eye movement patterns and rhythms to see how well your brain is functioning. Just to let you know, your brain needs two things to survive. Your brain needs fuel and activation. Your brain needs energy to work properly and enough signal production to work properly. Now the fuel part, the energy part, it comes from two things, glucose and oxygen. Very important. Glucose is handled metabolically. Think about it. When you don't take carbohydrates for a while, you become mentally sluggish. That's the reason. I'm not telling you carbohydrates are good or bad. I'm just saying in general. Oxygen is extremely important because brain does not store oxygen. Your muscles do. Your muscles do store oxygen. Your brain does not store oxygen. That's why constant flow of oxygen is important and it's imperative. Now, the problem is, as you age, your ability to utilize oxygen, it diminishes. Actually, it diminishes about 1% a year after the age of 25. So this means if you're 50 years old now, your ability to utilize oxygen has diminished 25% already. And next year is going to be 26%. So we may all be oxygen deprived. Just to let you know, you may go to your primary care physician. Your primary care physician, he or she may say that you are not oxygen deprived. I just want you to be aware, they're testing you with the pulse oximeter based on your cardiovascular system, if you're oxygen deprived or not based on your neurological system. What we're talking about oxygen you're deprived based on your neurological stem. Now, in addition, very important, in addition, in your brain, there is a part called the brain stem. Now, brain stem has top and bottom. Top area, we call it mesencephalon. The middle part we call pontomedullary region. But I don't want to be technical as much now. The top is mesencephalon. It's the top of the brain stem. The bottom, we call it the bottom of the brain stem. The job of the bottom of the brain stem is to make sure the top of the brain stem doesn't work too hard. So if the top, the mesencephalon, if it works too much, no good. If it works little, it's good. Now, a lot of the problems that you're having is because the top area is working too hard. Why? Because the bottom area doesn't prevent the top to work too hard. So what we need to do, we need to fix the loop that happens in the brain. And that loop, just to let you know, it's neocortico-thalamo-hypothalamo-pontomedullary reticular activating system. If that loop doesn't work properly, there's a problem, because that loop causes the bottom of the brainstem not to prevent the top of the brainstem, which is the mesencephalon area, to relax. And that could cause chronic fatigue. That could cause you feeling low energy, mood swings, night sweats, sleep difficulty, hormonal imbalance. Yes, menopausal symptoms, hot flashes, being depressed all the time, having skin problems, gain weight easy. So what we do neurologically, we give you supervised oxygen treatment on site prescribed by our doctors. Oxygen treatment by far has been very successful on most of our patients. It works great. This treatment has been helping hundreds of patients successfully. Patients with fibromyalgia, patients with chronic fatigue, balance problems, migraines, sciatica, low back pain, thyroid, diabetes, attention deficit disorder. Yes, attention deficit hyperactivity disorder. That's another DVD by itself. I don't want to go on tangent. There is a reason there's an attention deficit. And the solution is not Ritalin. The solution is not necessarily drugs. The solution is doing brain-based therapy so the brain works at optimal level. The solution is cutting off gluten. Most kids with attention deficit disorder, predominantly boys, they're gluten sensitive, and with oxygen treatment they may be helped. Visual stimulation, great for migraine sufferers. We have red rose lens glasses. That, what it does, as you wear them, it slows down the upper brain stem. It slows down the mesencephalon. That's why it works. For migraine sufferers, it works great. If you have insomnia, oxygen treatment works wonderful. We do olfactory stimulation, sensation of smell. We do auditory stimulation. If you suffer from ringing in the ear, tinnitus, vertigo, geometric or geocentric vertigo, you could be helped. What we do, we have these headphones in the office. We have you listen to a specific type of music, like for example Mozart, that has a lot of high frequency and low frequency. That stimulates auditory, it does auditory stimulation. It slows down the upper brain stem. That is as far as neurologic treatment. As far as symptoms, how do we handle it? Metabolically, we treat you metabolically based on the results of the test. That is another reason you shouldn't take just vitamins off the shelf. For overall purpose is good, but that could cause some problems. The treatment protocol that you will hear has helped hundreds of patients successfully during the past decade. Glutathione treatment. Glutathione is an antioxidant system. It is a natural antioxidant. Glutathione is the #1 strongest antioxidant that I know about. Glutathione has to be produced in your body as a natural antioxidant. It does not as we age. Why? Because of toxins and garbage that we put in the body. Tylenol, acetaminophen, kills it. It kills it. It destroys it. You need antioxidants to get rid of free radicals. Free radicals are toxins in the body. Antioxidants, get rid of them. If your body cannot produce antioxidant, you have to give it. There's a specific supplements based on your needs and results of the tests that you need to take. Most patients have some sort of a gut infection that we have noticed. That includes me, by the way. If you don't take care of the gut infection, which is almost everyone, we're not going to fix it. I had a parasitic infection that I had to get rid of. I didn't even know about. I had to do the testing. Most patients, they need a specific type of a cleanse detoxification system to get rid of the toxins. That by itself could make you lose a lot of weight because you get rid of toxins. When you get rid of toxins, your body normalizes, your body functions normally. High cholesterol does not kill you. Toxins will. High cholesterol does not kill you. Inflammation will. You have a lot of inflammation in your body. I guarantee that. Everyone does. With American diet, with what we put in our mouth, with what medications do we take, so on and so forth. We have had many patients that just by being on a cleanse system, they have lost weight.
He truly cares. He's published, he has integrity, and he helps people eliminate pain and prevent long-term, very disabling scenarios. This is Joel Bauer. I believe in Dr. Maz.
And I'm happy to say in the visits that I've had at MedWell, I have come a long way. My first appointment, I needed assistance from the car to hear. How I got into the building, I don't even remember. Now, I am walking on my own. I'm able to dress myself without screaming in pain. I just don't know what else to say except that I am almost 100% mended, and it's thanks to MedWell.
So ask yourself this: how are your symptoms is affecting you with your job, with your finances, with your relationships, with your family, and other activities that you do? What is it costing you in terms of time? What is it costing you in terms of money, in terms of happiness? Being able to sleep well. Where do you picture yourself in a year from now, in 3 years from now? Do you think it's going to get better by itself? Where do you picture yourself in 5 years from now if you don't take care of this? What is it costing you not to be able to do what you want to do? If you're serious about correcting this problem, you need to contact our office. If you don't care about your health, do not call my office. If you don't want to follow my advice, do not call our office. Our doctors are here to help you. I don't need to do this anymore. I can stop tomorrow. I do this because my passion is to help people to live better and add value to your life. You can get treatment or not get treatment. It's not going to make a difference in my life, but it makes a difference in yours. Your health is your responsibility. Your health is not your employer's responsibility. Your health is not your government's responsibility. Your health is not even your insurance's responsibility. Your health insurance is a sickness insurance. Your health, it is your responsibility.
I came here because I couldn't sleep at night, excruciating pain, kept me awake. I mean, it's been a couple of years. I'm on morphine patches. I got off of them now, and I'm sleeping through the night, and I feel so much better. I mean, unbelievable. In 7 visits, I can't believe it.
Sometimes people who are skeptical about care, they come and tell me, Dr. Maz, I want to go talk to my doctor. My response to them is that if your doctor knew about what I'm telling you, you would have been better by now without taking any more pills. Your doctor is treating your symptoms and not fixing you. Your doctor is trained with doing some testing, giving or labeling you a condition, and give you medications for your symptoms. There are only a handful of selected doctors in the northeast of the United States who are trained in what we do. If it makes sense, what we have said, call our office. Or at least go to a doctor who understands functional neurology, functional endocrinology, and diagnoses you metabolically and neurologically. Also treats you metabolically and neurologically. If your doctor can do that, that is great. Please do that. If you do not want to come to us, for whatever reason, it's fine for us. Please find a doctor who will run all the lab work, such as thyroid panel, adrenal stress index, specific markers that we mentioned, specific hormones that we mentioned, check you for food sensitivity, and manage you based on functional neurology and functional endocrinology. If you believe your doctor who has not run these tests and you believe he or she can help you get rid of your symptoms and find and fix the cause, do that for yourself. It is your responsibility to take care of your health. Otherwise, we'll here for you. That is, if we accept you for care. I'm asking you permission to help you. If you're serious about getting rid of your symptoms, if you're serious about getting your symptoms handled, our office is for you. Call 201-848-8000. Not everyone is accepted for care here. We only accept patients who we feel that we can help. So, if what we have said to you has made sense to you, you need to call our office and make an appointment with one of our new patient coordinators. When you come into our office for consultation, you may start testing and treatment the same visit or the following visit based on how busy we are. Unless you're coming from out of the state, then as a courtesy, we start you with testing and treatment the same visit. Can we guarantee that treatment is going to work? Absolutely not. We cannot guarantee anything. We cannot guarantee that testing is going to work, the supplement is going to work, or anything is going to work. Are we successful? Yes, very successful. Defining, designing, and developing a treatment plan that is second to none. How many by shows of hands are interested in the gift? This is Dr. Maz saying thank you for watching this video, and I will look forward to seeing you in the future. You can call us at 201-848-8000. Yes, we accept most insurance plans, and God bless you and your whole family.